That's one of the hardest things to work on. Number one, tracking readmission data is very interesting because the readmission data usually is a little bit lagger, as what impacts the metric to a facility is not just the patients that are discharged from your facility and come back to your facility. It is a patient that is discharged from your facility and is admitted elsewhere. And sometimes gathering that data back or receiving that feedback takes a longer time. So in the future, that would be amazing that we could have more real-time assessment of that. But I think number one is early planning. So number one, making sure that as soon as the patient comes into the facility, there is a good comprehensive assessment that is not only there to address what is the reason that the patient was admitted and what is the acuteness that brought the patient in, but also what are the other risk factors for that patient to come back. And I think number one is, will the patient have the formal resources to be able to get the medications timely? Number two, will the patient have the resources, the help, the support to take the medication as indicated? Number three, does the patient understand the instructions upon discharge in a clear way, not in a medical terminology way, in a very clear way that that person can understand what they need to do and how they need to take their medications. Number four, timely evaluation and assessment on the outpatient side, that within the next 3 to 5 days, they are in the primary care physician receiving a formal follow-up visit so that they can go over what happened in the acute side in the hospital and what needs to happen from that point on, and the instructions that were given for the outpatient or the continuum of care outpatient. So that transition of care component, things like us. And we do this on a regular basis where we pick up the phone and call the patient within the first 24 to 48 hours. And we have a nurse that call the patient and address, hey, did you get home well? Is everything going well? Did you get your medication? Are you clear on your follow-up appointment? Do you have it already? Do you have any other particular questions about your care? That is kind of being proactive. The more proactive that you are, and the more informed that the patient and their loved ones are, or the individual or individuals taking care of that patient, definitely the better. Proper transition of care documents, that those files get to the primary care physician, that it's going to continue the care of that patient in a timely manner so that they can understand quickly what happened to the patient with the level of accuracy necessary to make the good continuum of care. The other side of it, I believe, is identifying patients that did come back, identifying those readmissions upon their arrival to the ER, and immediately triggering and flagging them and making sure that we address what happened. Where did it fail in the process so that patient had to come back? And understanding what was the reason for that patient to come back. And most of the time what we find is exactly the things that I mentioned that we need to be proactive about, which is number one, could not get the medication. Number two, didn't understand well how to take the medication. Or number three, couldn't get a timely follow-up with the primary care.